Hi, this is Brandon with Chiropractic, and I want to talk about posterior tibial tendon dysfunction. And I know this week's blog was on orthotics. However, orthotics have a great place in the treatment of posterior tibial tendon dysfunction, but more so when that's more of a chronic stage, leading to a pes planus, or I call it a sloppy foot, a foot that's unable to supinate. And these people come into my office often with comorbidities. You know, they have plantar fasciitis, they have long-term foot pain, and Morton's neuromas, and Achilles tendonitis, and a whole myriad of issues with the lower extremity. But this is one that's very easily identified, and when it's acute, easily treated. So the things that we do to identify it is usually listen to the patient. They're going to tell you it hurts, especially when they're pushing off. So when they're going to push off as far as their gait cycle or when they're running. They're often going to have pain at the medial malleolus, you know, just pushing just behind, just posterior to the medial malleolus. They're going to have some pain, tenderness, some swelling. And they're often going to have that pain that's just kind of aching up into the shin. Very rarely are they going to have any kind of issues unless they're having some tarsal tunnel syndrome of numbness or tingling going down into the foot, and it's going to be more of a localized dysfunction when they're actually using it. Now, the reason I want to do a blog over this, and I want to do a video on this, is because there's a couple simple things that we can do to treat this. As far as treating, you can use your instrument-assisted manipulation, which you can see here. And this is great to get things to calm down when you're moving along the longitudinal fibers of the muscle. It's very sedative to the muscle. It's anti-inflammatory, so that's something great to do. You can do your soft tissue manipulation. You can do your active releases and your Grassons and your FDMs and all the other letters you have behind your name. Whatever you're great at, do. But one great way to prevent this from happening again and to get that foot a little bit stronger are 3 exercises. One you're going to see here, and this is the eccentric posterior tibialis strengthening exercise. This is a great exercise to start using the posterior tibialis. You can also do this exercise, which is more of a resisted posterior tibialis strengthening using a band. Works well as far as isolating that muscle and getting to stimulate that muscle, build some capacity and resilience in there. And then you can also do a single leg stance. Now, this seems very simple. I use this mostly for my balanced patients. However, for these kind of patients with inability to supinate the foot, that one leg stance test really activates the intrinsic foot muscles and also the muscles across the ankle, including the posterior tibialis. So these 3 exercises are great. I would highly recommend using them for my next patient that walks in with posterior tibial tendon dysfunction. And then the last one that I really like for the phase 2 is Valais exercise, which you can see here. And as you can see with Valais exercise, you're trying not to hit your nose in the wall, but you're really going to activate all those lumbricals and all the posterior compartment to help build us once again some capacity and resilience. Get those muscles strong enough to help keep up with the other muscles in the leg, whether it's the anterior tibialis or posterior compartment. These are great exercises to have in conjunction with what you're already doing in practice. Hopefully you can get some better results with your patients, and treating these patients, get them in and out of pain as fast as possible. Thanks for listening, and I look forward to talking to you next week.